I'm just going to do a summary of the things that we talked about yesterday with mental health first aid. So the first thing that I talked about was that definition of health. And so when we look at that definition of health, we need to remember that it includes physical, mental, and social well-being. And what we realized yesterday is that a lot of people will rate physical health as higher than mental health. And when you look at that definition of health, a lot of people also don't realize that it's that social well-being. And remember that example that I gave to you yesterday is that if you think about somebody who, say, is living in a boarding home, so they have one room to themselves, and they don't have that social support network. And then what happens is not having that social support network could eventually affect their mental health, which in turn could affect their physical health. And so, we had some good, people said yesterday about stability, about balance. And that's what that health is, that definition of health. And the one thing to think about when we look at that definition of health, remember I gave you the example of the triangle. And what happens is that when one part of that triangle collapses, it affects the other part of that triangle. And that mental health and physical health are not separate, but they are intertwined. And then we looked at the definition about mental health, and how mental health affects the way that we think about things that happen, the way that we deal with stresses of our life, the way that we cope with problems that come up in our life, and that when our mental health is out of balance, that eventually it will affect our physical health. So then we looked at, why do we need mental health first aid? What are the reasons that we need to learn about mental health first aid? And remember, the goal of mental health first aid is to be able to get you to recognize the early signs and symptoms of somebody developing a mental health problem or in a mental health crisis, being able to provide that initial help, and then guide that person towards the appropriate professional help. And remember, when we talk about appropriate professional help, it's whatever appropriate for the situation that is going on. It may be 911, it may be an elder in the community, it may be a mental health worker, right?